sealers can cause staining in the teeth. Other examples are such as Roth, Tubiseal, Grossman's. This one is from Cybron, Tubiseal. Do you have that one? Do you have the sealer with you today?
The vials, right?
Yeah, you have yours, yeah? Calcium hydroxide can also be used as sealers. It's great. It's a great product. It has antimicrobial properties. It's osteogenic and cementogenic potential. So especially in canals which have open apices, you could use and would sometimes prefer to use calcium hydroxide, but it'll cause a good seal there. Seal Apex by Kerr is a good example, CRCF. I haven't used calcium hydroxide sealer myself, so I'm not sure how the post-op pain causes it or not. I don't know that. Glass ionomers can be used as sealers. They have a very good dentin bonding properties, and that's the problem, because then it's impossible to retreat that. It forms such a good adhesion between the material and the walls that if you get a case which you need to retreat, it has a glass ionomer that's used sealer, it's next impossible. You'll just have to drill through. Ketec Endo is an example for that sealer. Resin sealers have been are coming in the market and have been very well documented. They provide good adhesion to dentin walls. They don't have eugenol, so if you're trying to retreat a case where your chloroform is dissolving the gutta percha but it's not completely coming out, that's because it could be a resin sealer that is used. So what you really need to use is Endosolve R. It's a solvent which dissolves, debonds the resin bonds. It's called Endosolve R. AH26 is an example, but then Dentsply had to change the formulation because it was releasing formaldehyde when it was setting, so they came up with AH26 plus. Paraformaldehyde sealers. I'm sure you guys have seen a case of Sargenti once or twice. Very, very hard to retreat, stains the tooth completely, called Russian red. They were introduced in Europe, pretty much used in Russia, called Russian red as well. Their soft pace and controlling them was difficult. So they were usually overextending in the canals, and overextension caused osteomyelitis and paresthesia. That's why they're completely banned being used in US and off the market. They also caused neurotoxicity. So they're no longer used. Bioceramic, and do you want to talk about that a little bit? Or you have it?
Yeah,
right?
I have it all here. It's basically antibacterial,
Yep.
pH.
So this is one of the latest sealers out there. Both me and Dr. Shani have used this. Shani, are you using this as a sealer or just as a...
Not as a sealer.
Not as a sealer. It
We
comes
use
in
it as a repair material.
repair material. It comes in syringe as well as a putty consistency. So you can use it as a root repair material as well, or syringe and inject it. Very good flow, superior bonding. It's biocompatible, very less shrinkage and osteogenic properties. So that sounds like a very, very promising sealer. So to coat the sealer, like I was saying, I generally coat my canals with using both paper points and master cone. So once I've dried the canals, I'll take sealer and very well coat my canals with paper points. Then on my master cone, at the apical 1/3, I'll coat the sealer again and then put my master cone, just to get a lot of sealer in the canal. That's what I use. You can use files. If your last file can be used, just make sure you're doing anti-clockwise so that the sealer gets and coats on the wall. Lintulus spirals have been used previously, but a little caution there because they can separate and stain the canal. The sealer. Once the sealer is done, you want to... What core materials are you going to use? So a whole bunch of core materials are out there. Silver points were used back in the days. Gutta percha is most widely used. Thermofill is a new core material, which is by Dentsply. Resilon cones can be used, and you can customize your cones to obturate the canals. Silver points were introduced back in 1941 by Jasper, no longer used anymore, below the standard of care, because they caused a lot of micro leakage, They corroded as soon as they came in contact with saliva or tissue fluid. And the corrosion product were very cytotoxic, so they were just completely... retreating them was difficult also. Sometimes it was very easy, just they would come out easy, but sometimes if they were wedged into a very curved canal, it was hard to take out. And a little piece of the silver would just snip right there, and then it was difficult to get to that. They can discolor teeth as well. Have a diagrammatic presentation here. Silver cone used in tooth number 8 caused periapical lesion because there was no seal, caused corrosion, caused discoloration. The tooth was retreated. Hollow plug was used here. A little bit of MTA, and then the rest of the canal was filled with gutta percha. Gutta percha. It was introduced by Hills in 1847. He started using gutta percha in 1847, called hill stopping. It was also used in golf balls, probably still used. But to use this dentistry, they had to change a little bit of the composition. So they added pacifiers, zinc oxide, and plasticizer. The alpha phase is the heated phase that we use in warm compaction obturation technique because it's pliable and tacky. And with pressure you can compact this part of the gutta percha, this phase of the gutta percha. The beta phase is the one that we use in lateral compaction because it can be really compacted well. And believe it or not, gutta percha cones can be sterilized. So if you can put them in 1 minute in hypochlorite, they can be. So if they drop, you can pick them off and sterilize. These are some non-standard gutta percha cones used in lateral condensation. You can use one of them as master cone. Then the rest of the cones can be used for accessory cones to fill the canal. This is standardized gutta percha cone, 15, 20, 25, and so on. This is O2 taper, this is O6 taper, and this right here is pro tapered gutta percha. So it goes with F1, F2, F3. All companies have their own files, their own specific paper points, and laser verified gutta percha, so you could use any of those. Thermofill. Thermofill is one of the core, it's basically carrier-based gutta percha that Tulsa, Dentsply came out with. I think, when did they come out, Chris, with Thermofill?
In the late 80s.
Late 80s, so about 20 years or so ago. They started with metal being their core, the carrier material. Not so much, people didn't like it so much, clinicians didn't like it because metal core, you couldn't make post spaces easily. Retreating was getting difficult. So then the company made it into plastic. You could drill through it, you could create your post spaces with it. And now latest, they've come out with something called gutta core, where, and you have that, Chris, right? He has it, you guys can feel free to play with it and see how that works. Gutta core is gutta percha core, and then gutta percha surrounding it. So hopefully it'll be very easy to retreat it.
Is there a difference between gutta core and simple fill?
Simple fill and gutta, yes. And I have a video of simple fill, yes. It'll be coming up shortly, yes. So once you've cleaned and shaved your canals, you can verify your canals. The last file, these are called size verifiers. You can use those as your last verifying files, and corresponding to that is what they have, or size 40, this is size 40, where you can use that in the canal. So you heat this in the oven. I have a picture of that later in the slide show, and I'll show it to you. You heat this carrier in the oven, you put it in the canal softly and gently, and then you can snip this right here with either using a spoon or just preppy burr, and that's it, and that's all to obturate in the canal. Yeah, you take a little, you slowly, a few seconds too, and then let it cool for a couple seconds, and then take it off at the orifice. Resilon has been really, really marketed and is a good material as a core material, being used with the Epiphany as a sealer. It's a resin-based core material. It comes in cones and pellets. The core is basically a polyester resin, bioactive glass, and the sealer is bisphenol A, a glycidial methacrylic. It's a very good material to use. It bonds very well to the dentin wall, forms a monoblock basically. I'll show you. This is the sealer. It comes in injectable syringe type. Its own primer, so you can use your Resolon cone size specific ISO standard gutta percha. It's Resolon points, and you use the sealer. So your last rinse, like I was saying, how important EDTA is to rinse with EDTA, it's very critical because Resolon cones will not bond to the dentinal wall if EDTA is not used as a last rinse because hypochlorite affects it. You dry the canals. Once the canals are dried, you prime it with that primer right here, its own primer, and then you use the Resolon points, and then the sealer that you've coated, the Epiphany sealer, you can let it sit there, but it takes about 25 minutes to set, or you can cure it for 40 seconds. It forms a solid block. So it's very, very good because it does not cause any micro leakage. It forms one solid block. A lot of studies have been out there which have compared gutta percha with Resolon cones, and a lot of dye studies, and they have shown that Resolon really actually was better, if not as good, than using just gutta percha and collateral or warm condensation techniques. So it's a promising material. Have I used it myself? No, but I've worked with it, but not used it on patients. It strengthens the root a lot.
Is it difficult to retreat?
Resolon? No, you have to use endosolver though. Resolon, yeah. It's not difficult to retrieve. You can customize cones yourself. If you have a very wide foramen or apex, you can customize the cones. What you can do is you can take a bunch of cones, heat it with a heating torch, roll these cones on 2 glass slabs. So basically you can form your own length, and 2 months or 3 months ago I had a patient with a canine 33 millimeters. Now I could have taken the inside ledge off to shorten my length or something, but it was 33 millimeters. I wanted a long cone. The longest cone that we had was 31. And the apex was almost 55, so I did this technique. So I took a bunch of cones, I rolled them on, I heated them, I rolled them on a glass slab, made my own custom cone. And then what I did was, and that's exactly what I explained here. What I did was I took the cone, the tip of the cone, and I put it in chloroform. Just for 1 to 2 seconds, kind of softens the cone a lot. So then you can take the main cone and put it in your canal, slowly, gently put it for a couple seconds, take it out, let the cone cool. It's basically taking the impression of your apex. So it customizes the cone specific to the canal that you're obturating. You could use a eucalyptol oil or halothane, but chloroform is readily available in the office, so that's what I use. And
Didn't they used to have a technique where you did that, but they kind of, I thought they nixed that because the chloroform tended to cause it to shrink too much, yeah. Because that used to be one of the techniques is you'd customize your cone with chloroform.
Right, so what I do is I just put it in chloroform just for a couple of seconds, and then I do it a number of times, and then I let the cone sit there and cool, so it hardens it. It goes back to the beta phase. Yes.
With using the Resolon, if you want to create a post space, and you're using a handpiece to do that, could the vibration create a debond?
No, it does not. It doesn't cause a debond.
And you don't have to wait at all, there's no,
You don't have to
you know, with a handpiece, when you're using a handpiece,
to create the
creates
post phase.
vibration.
Yes, but one of the studies showed that it does not debond. It doesn't cause that problem.
How long does it take to set?
Resolon, the sealer, it's at 25 minutes.
45 minutes.
And so if you just cure it for 40 seconds, it's set. It's 1 block right away, so it's a good curing light.
Cure it with curing
How
light?
do you-
Curing light, yeah. So you put your sealer, then you put your cone, Resolon cone, and then you just cure it.
So it was just kind of like a top layer to cure it.
Top layer, yeah, the sealer will coat. Okay, so that's that with the core materials.